Influenza. The flu influenza is an infection of the nose, throat, and lungs, which are part of the respiratory system. Influenza is generally known as the flu, but it is different from stomach flu viruses, which cause diarrhea and vomiting. Causes: influenza viruses travel through the air in droplets when someone who has the infection coughs, sneezes, or talks. You can inhale the droplets directly. You can also come into contact with germs through an object, such as a phone or computer keyboard, and then transfer the viruses to your eyes, nose, or mouth. People who have the virus are likely to be contagious from about the day before symptoms appear until 4 days after they start. Children and people with weakened immune systems may be contagious for a little longer. Influenza viruses are constantly changing with new strains appearing on a regular basis. If you've had the flu in the past, your body has already made antibodies to fight that specific strain of the virus. If future flu viruses are similar to ones you've already faced from having the illness or from receiving the vaccine, those antibodies can prevent infection or reduce its severity. However, antibody levels can decrease over time. Also, antibodies to influenza viruses you've been exposed to in the past may not protect you from new strains of the virus. The new strains can be very different from the viruses you had before. Symptoms: at first, the flu may seem like a common cold with a runny nose, sneezing, and sore throat. Usually, a cold develops slowly. But the flu tends to come on suddenly. And while a cold can be a nuisance, you usually feel much worse with the flu. Common flu symptoms include fever, pain in muscles, chills and sweating, headache, persistent, dry cough, shortness of breath, tiredness and weakness, stuffy or runny nose, sore throat, eye pain, vomiting and diarrhea, but this is more common in children than adults. Complications: if you are young and healthy, the flu is usually not serious. Although you may feel very sick while you have it, the flu usually goes away in a week or 2 with no long-term effects. But children and adults at high risk can develop complications that may include pneumonia, bronchitis, asthmatic flare-ups, heart problems, ear infections, acute respiratory distress syndrome. Pneumonia is one of the most serious complications. It can be deadly for older adults and people with chronic illnesses. Risk factors. Factors that can increase your risk of getting the flu or related complications include age. Seasonal flu tends to have worse outcomes in children younger than 2 years or in adults older than 65 years. Living or working conditions. People who live or work in facilities with many other residents, such as nursing homes or military barracks, are more likely to get the flu. People admitted to a hospital are also at higher risk. Weakened immune system. Cancer treatments, anti-rejection drugs, long-term steroid use, organ transplant, blood cancer, human immunodeficiency virus, or AIDS can weaken the immune system. This can make it easier to spread the flu and may increase the risk of complications. Chronic diseases. Chronic health conditions can increase the risk of flu-related complications. Some examples include asthma and other lung diseases, diabetes, heart and nervous system diseases, metabolic disorders, respiratory tract problems, and kidney, liver, or blood diseases. Use of aspirin for those under 19 years of age. People under the age of 19 who take long-term aspirin treatment are at risk of developing Reye's syndrome if they get the flu. Pregnancy. Pregnant people are more likely to have complications from the flu, particularly in the 2nd and 3rd trimesters. The risk continues up to 2 weeks after birth. Obesity. People with a body mass index BMI of 40 or higher are at higher risk of complications from the flu. Types of virus. Influenza virus nomenclature for a flu-gen flu virus. Influenza viruses comprise 4 species. Each of the 4 species is the sole member of its own genus, and the 4 influenza genera comprise 4 of the 7 genera in the family Orthomyxoviridae. They are: Influenza A virus IAV, genus Alpha influenza virus. Influenza B virus IBV, genus Beta influenza virus. Influenza C virus ICV, genus Gamma influenza virus. Influenza D virus IDV, genus Delta influenza virus. Genome and structure. The hemagglutinin HA and neuraminidase NA proteins are shown on the surface of the particle. The viral RNAs that make up the genome are shown as red coils inside the particle and bound to ribonucleoproteins RNP. Influenza viruses have a negative sense, single-stranded RNA genome that is segmented. The negative sense of the genome means it can be used as a template to synthesize messenger RNA mRNA. IAV and IBV have 8 genome segments that encode 10 major proteins. ICV and IDV have 7 genome segments that encode 9 major proteins. 3 segments encode 3 subunits of an RNA-dependent RNA polymerase RDRP complex, PB1, a transcriptase, PB2, which recognizes 5' caps, and PAP3 for ICV and IDV, an endonuclease. The matrix protein M1 and membrane protein M2 share a segment, as do the non-structural protein NS1 and the nuclear export protein NEP. For IAV and IBV, hemagglutinin HA and neuraminidase NA are encoded on 1 segment each, whereas ICV and IDV encode a hemagglutinin esterase fusion HEF protein on 1 segment that merges the functions of HA and NA. The final genome segment encodes the viral nucleoprotein NP. Influenza viruses also encode various accessory proteins, such as PB1F2 and PAX, that are expressed through alternative open reading frames and which are important in host defense suppression. Virulence and pathogenicity.